Hello, everybody. Welcome to Miss McGuire video lectures. And today we are covering the axial skeleton. So let's go ahead and begin. Yes, and I'm using OpenStax free online textbook. Okay, so the skeleton is divided into two major divisions, axial skeleton and appendicular. And on this diagram, you can see the axial skeleton in blue color and appendicular in yellow color. So axial skeleton includes bone of your skull, your vertebral column, your rib cage, and everything else is part of appendicular skeleton. So appendicular skeleton includes clavicle and scapula that form pectoral girdle, and then bones of upper limb. And it's also include os coxa bone over here, or hip bone, that are actually three bones fused together, and bones of lower limb. And this os coxa is your pelvic girdle, right? So those are part of appendicular skeletons that we will cover in more detail in our next lecture. So today we will concentrate on skull, vertebral column, and rib cage. So here's our axial skeleton that is vertical central axis of your body, contains bones of head, neck, chest, and back, and function in protection of the brain, spinal cord, and some your internal organs that located in thoracic cavity, and partially even protects organ of your abdominal cavity, like part of the liver or stomach. But the main protection of lungs and heart. Also attachment point for muscles. Axial skeleton is made of 80 total bones, 22 skull make up your skull, 7 additional head bones, 24 bones in vertebrae column. So those are your vertebrae. Sacrum, Coccyx, they are fused vertebra, and sternum. Okay, do we have ribs over here? Oh yeah, 12 pairs of ribs. I'm like, oh, we cannot miss our ribs. So we have, again, skull, vertebrae, sacrum, coccyx, 12 pairs of ribs, and sternum, and 126 bones in the appendicular skeleton. So let's start with skull. So the skull is made up of cranium and facial bones. So your skull, it protects your brain, protects your face. It forms some opening like nasal cavity, oral cavity, bony orbits that protects your eyeballs. And I already mentioned it protects your brain. It houses the middle and internal ear structure. And we have 22 individual bones in adult, 21 are immobile. So they fuse together through structures that are called sutures. And there is only one mobile bone, that is your lower jaw. In anatomy, anatomical name is mandible. So mandible is movable or mobile, and 21 immobile bones. So over here, just very quick overview of anterior skull. So if you look at this diagram, you can see how many different parts and features we can identify on a skull. It's really overwhelming. So let's just make it easy and just cover part of that. So what you can see here? Oh, obviously you can see bony orbits. That's nice big structures over here. You can see nasal cavity. Right? You can see some, bony projections on the lateral wall of nasal cavity. You can see septum that separate nasal cavity into right and left cavities. You see those alveolar processes that houses your teeth. And then if you look here, see kind of you have like some openings like this one, that one. So this hole or opening in anatomy is called foramen, or plural is foramina. So let's try to find supraorbital foramen. Supra means above. Orbital means your orbits, right? Bony orbit. So this is some opening above your orbit. So here it is, supraorbital foramen. Now, infraorbital foramen. Infra means below, so it's an opening below your orbit. So here's infraorbital foramina, and sensory nerves and blood vessels are moving through these openings and innervate the muscles and skin of your face, and also bring oxygen, remove carbon dioxide, right? So, so on. So blood vessels and nerves. Nasal concha increase surface area and function in warming and humidification of inhaled air. Now, if you look at a lateral view of the skull, what we can see here? We can see this nice structure that is called zygomatic arch. That would make your cheekbones. And it's made of two bones fused together, now shown here in green and shown here in purple. Now, the green bone is called zygomatic bone. The purple bone is called temporal bone. And these bony projections are called processes. So this process that I'm coloring right now, right, this is called zygomatic process of the temporal bone. And this process over here is called temporal process of the zygomatic bone, right? So together they form your zygomatic arch. And one very important muscle of mastication, masseter, part of this muscle is attached to zygomatic arch. And then it's also attached to your mandible. So that's a jaw muscle attachment. The brain case. So you have a cranial cavity, and cranial cavity is surrounded by skull. Now the cup of the skull is called calvaria. So that's a calvaria over here. And if you look inside, you see several fossa. So those are kind of like depressions inside, giving a space to maybe put some parts or some organs. And sure enough, we have a brain that is located inside cranial cavity, and different parts of the brain, different lobes are located in this fossa. So you see, this is the frontal lobe of the brain, and it's inside the anterior fossa. So this is temporal lobe of the brain, and it's inside of middle fossa. And this part of the brain is called cerebellum, and it's inside posterior fossa. Right, so we have, if you talk about brain case or cranium, we have 8 bones that make up this structure. So let's look at each bone in a little bit more details. So we're going to start with parietal bone. We have 2 of them, left and right parietal bones. I know my video is here, right, on your, and I cannot move it. So sorry. But this was shown here in green. That's a parietal bone. It's the upper lateral side of skull. So it's upper and lateral side. So it's right here, upper lateral side of the skull. It's a paired bones. and they bounded by frontal, temporal, and occipital on the back. Right, so if you look over here, that shows actually temporal, but here's the parietal. So here's the parietal bone. So that's a parietal. So that's a right parietal bone. Next bone is temporal bone. It's also paired, shown here, right here in the green color, right? Nice green color. And it's a lower lateral side of the skull. So it's on the lateral side and it's inferior. It has multiple regions. One we already described, this one, zygomatic process of the temporal bone. Now this one is called external acoustic meatus. This is where your external ear canal is located. Right now, this process is called styloid process. This process is called mastoid process, and you have many muscles attached to these processes over here. Frontal bone, shown here in green. So it forms your forehead, and it also forms the part of the bony orbits, like superior part of the bony orbits. And it has one structure that we want to know right there, and it's called glabella region. Now, occipital bone is a posterior and inferior part of the skull, shown here in green. And it has this big opening here that is called foramen magnum. Foramen, again, it's opening. Magnum means it's really huge. And above the foramen magnum, you have your brain, specifically brain stem. And below foramen magnum, you have spinal cord. Right, and another features over here, like this one here, and this is called occipital condyles. And they articulate, so they make joint with the C1, the first cervical vertebra. So you can, you know, kind of like move your heads, right? So that's, no, you move your head because of the, yeah, so you do have some movement, like this kind of movement. Yes. So again, what are those occipital condyles? Occipital condyles are a bony parts of the occipital bone that articulate with C1 vertebra. And it's a movable joint that allow you to move your head. Next one, sphenoid bone. So sphenoid bone is located inside the cranial cavity, inside the skull, shown here in green. It's a keystone bone, so it joins with almost all other bones of the skull, and it's the base of the central skull. So if you just look at individual sphenoid bone right here, it does look like a bat, B-A-T, or look like a bird or butterfly. And that's why it has structures that they call wings, right? So those are lesser wings, those are greater wings, right? So that's a greater wings, lesser wings. They have very interesting opening, very important. It's called optic canal. And this is where optic nerves actually go through. So optic nerve goes from your retina to your brain through the optic canal. Another interesting feature of the sphenoid bone is this part over here, or over here, right in the middle, right? And this is called sella torsica, and sella torsica means Turkish saddle. And inside the sella torsica, you have hypophyseal fossa, and what sits on this inside this fossa is pituitary gland. We do have pterygoid plates that we cannot see on these pictures, actually. And so you can just say that chewing muscles are attached to sphenoid bone. some chewing muscles. Ethmoid bone. Ethmoid bone make a roof and lateral wall of the nasal cavity. So again, it's shown here like this green color, right? That's your ethmoid bone. So actually, I like this diagram. Maybe it seems like it doesn't have much sense, but it's a coronal cross. So for example, if you kind of take this coronal cross and it's very thin part, right? Like a very, thin part of the bone. And here you can see ethmoid bone is actually very, very nicely, right? So right there. So what it has perpendicular plate. So the perpendicular plate is right here, or it's right in the middle, right there. And perpendicular plate is a part of your nasal septum. So the septum separates your nasal cavity into right and left cavities. Then it has this structure over here that is called crista galli. I know I'm here. Let's see if I can remove myself. I don't know. I hope then you don't see me, but you see a picture. But here is the crista galli. So crista galli means rooster comb, and it's attachment to very important structure that is called dura mater. So the dura mater is a tough membrane covering your brain, and it attaches to this crista galli. You also have cribriform plate, and cribriform plate is this part here and over here, and inside you have openings, right? And it's called olfactory foramina. And olfactory nerves go through this foramina and they enter nasal cavity. So here's a lateral view of the skull. All right, so that's, yeah, well, it's not exactly mid-sagittal, say like the sagittal cross, because it doesn't go right straight in the middle, but sagittal section. So you can see here, so you can see this ethmoid bone right there. You can see sphenoid bone. So here's the sphenoid bone. And inside the sphenoid bone, you have this cavity. It's called sphenoid sinus. You see a frontal bone. So here's the frontal bone, and you have this sinus, that is frontal sinus. And sinuses are spaces inside bones that cover by mucous membrane, and they function in humidifying and cleaning and warming up the inhaled air. And they believe that they also make your skull lighter, so it's not that heavy. Because you have like spaces filled with air, right? You can see another structure here, like this bone. We didn't cover it yet, but we will. This is the inferior part of the nasal septum, and it's called vomer. Now, this is a hard palate, right? So that's a hard palate. And hard palates separate your oral and nasal cavities. And anterior part, like this one, this is part of the maxilla. But this part over here, this is also like individual bone that is called palatine bone. You also can see here in the temporal bone, internal acoustic meatus. What is that? How to get rid of this? Here we go. That's acoustic meatus. Right, okay. Nasal concha. In your nasal cavity, on the lateral side, you have these bony structures, right? And they make what we call nasal concha. So we have superior nasal concha, middle nasal concha, and inferior nasal concha. So superior and middle, they both part of this bone, right there. That's your ethmoid bone. So that's ethmoid bone. So this is crista galli. And inferior nasal concha, this is its own bone. We have two of them, right? So shown here in green. And the function of nasal concha is to give a turbulence to the inhaled air. So air, instead of going straight through your nose to your pharynx, it goes like in a spiral. It has this turbulence, and it gives time for you to warm up this air, humidify, and clean it, right? So that's it. And it also increases the surface area of nasal cavity. So you have larger surface area for mucous membrane, and mucous membrane pretty much protects you, right? So, removes, you trap bacteria or some pollution, that can be within this inhaled air. So you clean the air with the help of mucous membrane, and because of nasal concha, you have increased surface area, right? And again, what I said, it just gives this turbulence to the air. So it gives you time to clean and humidify inhaled air. Okay, sutures. What are sutures? Sutures are immobile, that means immovable joint that keeps together bones of the skull. Remember, we have like 22 bones, and 21 of them are connected by sutures, and one is movable, that is your mandible. So sutures are made up of dense fibrous connective tissue. So it's right here, dense fibrous connective tissue. And here's the sutures that you guys need to know. So we have coronal suture that connects frontal and parietal bones. You have this suture right here that is called squamous suture, and it's connect parietal and temporal bones. Squamous means flat, coronal means like crown, coronal cut. So here's the coronal again. This suture is sagittal, so it connects two parietal bones. And the suture over here is called lumboid suture, and it's connect parietal and occipital. So suture 1, coronal, squamous, sagittal, and lumboid. And of course, we have way more. And so every single bone, all these 21 bones, they connected by sutures, they all have names. But those are kind of like the biggest ones, the major one that we're covering in this lecture. Okay, so those were bones of the skull. Now let's move to facial bones. And we're gonna start with maxillary bone, shown here in green. And it's your upper jaw. It's also forms a part of the hard palate. So it's right there. That's a hard palate that separates your oral nasal cavity. And by the way, you see this bone? This is palatine bones. You can see maxilla, it's also actually 2 bones. So here, the suture. So like if the baby is born with cleft palate, and that when this sutures are not formed, maybe the maxilla is not fused, then somebody can have a cleft palate. So what maxilla forms? It forms, we already said, upper jaw, hard palate, medial floor of the orbit. So it's right here, right? Medial floor of the orbit, and lateral part of the nose. It has alveolar processes, right? So here's our alveolar processes that contains teeth. And yeah, we already said this form part of the palate, and those processes are called palatine processes. So right there, palatine processes. Another bone over here is mandible. So the mandible is the only bone that is a movable bone. So here you can see nice, that's all our mandible right there. And here's a mandible on its own. Now it has some processes like this one, pretty important one, and it's called condyle or condylar process. And this condyle process forms what we call temporomandibular joint, right? That's our movable joint is a sliding synovial joint that allow you, pretty good range of movement. It's also has this carotenoid process over here. Now this part is called ramus, right? So that's a ramus. So that's a ramus. This is the body of the mandible. What else do we want to know? Mandibular angle right here. And it's also made of two bones that they are paired at birth. They're fused in adult, and we already mentioned TMJ. That's our movable joint. Of course, it has alveolar processes as well. That has your lower teeth. Orbits. Orbit houses eyeballs. Also, you have muscles that move your eyeballs, muscles that move your eyelids, attached to some of these bones. And orbits are really complicated structure. So it's made of 7 skull bones, right? So let's look. Frontal, if you can find it, right? So here's the frontal, kind of like orange, right? So that's a frontal bone right there. Then zygomatic. That's our zygomatic. Oh, I'm sorry. Okay, so that's our zygomatic bone, blue, right there. Zygomatic bone. Then we have maxilla, that's upper jaw, so that's this purple one, right, maxilla. Then we have palatine bone, ethmoid bone. So let's, okay, so this one, the yellow one, is a sphenoid bone. This green one is a lacrimal bone. So we have maxilla, we have frontal. We cannot see a palatine bone over here, right? So we cannot see palatine bone. But so ethmoid bone, that is right here. So that's an ethmoid bone, right? Lacrimal bone is this green one. Lacrimal bone. Sphenoid bone is the yellow one right there. Right, so sphenoid right there. Zygomatic, maxillary, lacrimal, right, ethmoid. And palatine bone is just a little piece that always very hard to see. It's needed like a special view, but you remember what palatine bone is. Palatine bone is made the posterior part of your hard palate, and it has a little process that goes up and contributes in your bony orbits. Nasal septum. Nasal septum is made of bones and cartilage. So this is the septal cartilage. And this bone, we already know this is ethmoid bone, and it's called perpendicular plate. So it's right here, perpendicular plate of the ethmoid bone. And then you have vomer. So this is the vomer. So upper portion is perpendicular plate of ethmoid bone, lower is vomer bone, anterior is formed by septal cartilage. So anterior is a cartilage. And we already covered this nasal concha. How many times we need to cover it, right? Inferior, middle, and superior. So we're gonna skip it for a second, right? But it says what? Swirl incoming air, warms air, help mucus strip particles. Paranasal sinuses are air-filled spaces that reduce bone mass and give a resonance to your voice. So we have frontal, so right there. We have maxillary, obviously in the maxilla, in your upper jaw. Those are the largest. Then we have sphenoid. So let's see over here. I think here it's better. Sphenoid. So they are in the sphenoid bone. And ethmoid. So here's ethmoid. Where's the ethmoid bone? Remember there. Behind superior nasal conchae. So paranasal sinuses, that's their function. And you know, when you have sinusitis, sometimes it hurts here or over here, over here. That might be some, you know, infection or inflammation of these paranasal sinuses. And paranasals means close to your nose. Hyoid bone, right there. Does not contact any bone directly. It's not part of the skull. It's the bone that serves as a base for many muscle attachment. You know, like so many muscles attached to this bone. And it's also base for a tongue. Provides attachment point for muscles that acts on the tongue, larynx, and pharynx. Even, you know, those muscles even have names that include this hyoid, you know, part in their name, like sterna hyoid, from sternum to hyoid, sterna hyoid over here, or omohyoid, right? That's omohyoid. So lots of bone, or, you know, this one, digastric muscle, mylohyoid, this muscle, mylohyoid. So many attachment for many muscles that acts on your larynx, pharynx, and tongue. Okay, now we're moving to vertebral column. So we have 33 vertebrae. 24 that are not fused, and then we have sacral, like 5 sacral and 3 to 4 coccygeal vertebrae, and they are fused and they form structure called sacrum and coccyx, and sacrum and coccyx are part of your pelvis. C1 articulates with the skull, and it has curves, right? We actually the curviest animals. We have primary and secondary curves. Primary curves, we are born with them, and we develop secondary during our, you know, then development after birth. And primary curves retained from fetal curvature, and it will be thoracic and sacrococcygeal. So thoracic in a thorax right over here, like this, and sacrococcygeal. And the secondary curves, then cervical over here, and lumbar. So, and the cervical develops when the baby starts holding the head, and lumbar develops when babies start walking. So that's a curvature. And curvature are very important. That they reduce the compression force on your spine. So if your spine wouldn't have this curvature, every step would be pretty painful to you. Okay, so we do have some abnormal curvature of the spine. Scoliosis is abnormal lateral curvature. So you see how spine go to a lateral side. Kyphosis is exaggerated thoracic curvature. Actually happen in the people with the osteoporosis a lot. And lordosis is exaggerated lumbar curvature. And this one, you know, can be seen a lot in pregnant females. Or if female is wearing high heels, then you can see this exaggerated. But lordosis is abnormal. When you wear high heels, it just, shows this curvature a little bit better. And kyphosis, as I said, very common in elderly people with osteoporosis. Now, vertebral structure. So here we have like a typical vertebra that has anterior portion, right? So here's anterior portion, posterior portion. In the posterior portion, you have spinous process, and this is what you can palpate. If you palpate your vertebral column, then you're palpating this spinous process. It does has a transverse processes. So here's another processes, transverse processes. Pedicles are this part right here. And lamina is this part right there. It does have a foramen inside. It's called vertebral foramen, and inside this foramen is spinal cord, right? So we have posterior process, we have transverse processes, we have pedicles, lamina. We also have superior, like this, and inferior articulating processes. See, like this one, for example, see over here, this is inferior articulating process, and this is superior articulating process. So they articulate or connected with adjacent superior and inferior vertebrae, right? So anterior portion, so this is called the body, that is anterior portion of vertebra, and it supports weight of your body weight. In between vertebra, you have intervertebral discs. That is a cartilage. So cervical vertebra. Cervical vertebra has small body, carry least amount of weight, so pretty much just the weight of your head. U-shaped spinous process. Like, again, let me hopefully remove my, so you see, it's called bifid or U-shape spinous process, and it has these extra openings right there and right there that is called transverse foramina. And so only cervical vertebra has this transverse foramina because you have vertebral artery that goes to your brain through this foramina, right? Now C1 has a special name called atlas. It's the first vertebra holds the head, and C2 has a special name axis, and it's rotation point for head, and it has structure here that called dents. Right, so this is C1, and this is both, right, only different view. So this is superior view, this is anterior view, this is C2. So atlas came from the name of the guy who was holding the wand, right? And that's what they call atlas. And axis, because it's allowing you to move. So move in a different directions, different axes. Okay, thoracic vertebra. We have 12. Those are, they have large bodies, long spinous processes. Look at this. Ooh, that's a long spinous process. Goes pretty much kind of like down. They have superior articular processes. They have inferior articulated processes, the same as all vertebrae, really. And they have faucets. And faucets are points of attachment for your ribs. So, so here's the faucet, superior costal faucet, and inferior costal faucet, this one of this, and this is the vertebra attached over here. So we have 12 of them. Lumbar vertebra, the largest, have the largest body, short and blunt So they have blunt spinous process. So you see how those are more kind of like pointy and those are blunt over here. And short transverse processes. So that's our transverse process right here. So it's pretty short. Okay. So we have 5 of them. Sacral and coccyx. Sacrum is triangular shaped bone, 5 fused vertebrae. So that's your sacrum. Okay. And then, so that's a sacrum. And this is the coccyx, or what we call tailbone. It's a 4 fused vertebra. They do have this foramina, and this is where, so anterior sacral foramina, posterior sacral foramina, and this is where spinal nerves would exit through. So the spinal nerves would exit through this foramina, right? This. Now, between vertebrae, we have intervertebral disc. It's made of cartilage. It's actually a special type of cartilage called fibrocartilage. It fills gap between adjacent vertebrae. It gives a padding, and it actually gives you about 25% of your body height, because you have like between each vertebra, right? You have 24 movable vertebra. You have these pads. And if you look at the disc, it's made of 2 parts. One is called annulus fibrosus. Annulus means around, like if you have something annual, it's go through the whole year. So it's annulus fibrosus, and this is the fibrocartilage. And so it's tough outer layer, and then you have stuff inside over here that is called nucleus pulposus. This is soft inner layer, allows for shape change. Over here you have, you see the herniated portion of the disc. So when this disc is displaced and it starts pushing on a nerve, right? It compresses nerve and causes lots of pain, because this is vertebral foramen, and you have spinal cord, and then you have nerves branching out from the spinal cord. Now we do have ligaments that holds vertebrae together. So we have anterior longitudinal ligaments like this one. We do have posterior longitudinal that would be right here inside. We have supraspinous ligament, that is this one. And it's posterior to vertebral column and supports during forward bending. And anterior longitudinal ligament is anterior side of entire vertebral column, resists excess bending backwards. And superior or ligament, like a supraspinous ligament, that supports you during forwarding, when you bend forward, that supports you. Nuchal ligament is this part. And nuchal ligament goes from cervical spinous processes. So here's your cervical vertebra, and here's the cervical spinous processes to the base of the skull. It supports your skull and prevents it from falling forward, right? So those are ligaments. So they're made of connective tissue, dense regular connective tissue. Sternum and ribs. So sternum, what you call your breastbone. So it's shown right here, right? So here's the sternum, and it's made of 3 parts: manubrium, body, and xiphoid process right there, and xiphoid process. Now you have this where manubrium and body connects. This is called sternal angle, and you can palpate the sternal angle. There is very, importance of sternal angle in the surface anatomy. So you see, this is your sternal angle, and the second rib is attached to the sternum angle, and this is where the base of the heart is. So if I would draw the heart, the base would be right there. So in the surface anatomy, if you palpate the sternal angle, right, you know where the base of the heart is. Ribs are curved, flattened bones. They attach to thoracic vertebra T1 through T12. So shown over here, we have true ribs, we have false ribs, and floating ribs. So true ribs, another name is vertebra sternal, because they attach to vertebrae and to the sternum through cartilage. Actually, this is a cartilage, but each rib has its individual cartilage. So we have seven true ribs. So each rib has its own cartilage, and they attach to the sternum. Now, false ribs is rib 8, 9, and 10. They attach to the sternum, but but they're not directly attached. They attach to the cartilage of rib 7, right, like this, and then they attach to the sternum, and they call it vertebra chondral. And then 11 and 12 are floating ribs. They only attach to vertebrae, T11 and T12. So we call them vertebral ribs. And, you know, the function of your rib cage we already covered, protects your internal organs, right? Development of the skull. Now, during embryonic development and the first 6-8 months after the birth, babies have what we call fontanelles. And fontanelles is dense irregular connective tissue membrane. So dense connective tissue membrane that separates bones of the brain case. And we have several of them, like we have anterior fontanelle, posterior fontanelle, mastoid fontanelle, sphenoidal fontanelle. And the function of those fontanelles is to allow the cranial bone to move a little bit. And so this is necessary for during the event of birth, when baby goes through the birth canal, right? Then the bones can kind of be squeezed a little bit, so the head can pass through the vagina, through the birth canal, and they also allow space for brain to grow. So the brain grow pretty rapidly at very early age of our life, and you want you know, the skull to be able to grow as well. So if you know, bones are fused, you would have increased intracranial pressure. That is not good, right? So fontanelles allow cranial bones to be a little bit more movable. So during the birth, you know, baby can go through the birth canal, and it's also allow for brain to grow. And then they ossifies, right? And we call it soft spots, right? You know, if you have a baby, you can pretty much touch here, and you will feel like that's a soft spot. That's why you need to be really careful with your baby, because that's just, you know, membrane that covering the brain, not that much protection, but it will ossify and it will close up. Okay, anyway, this was the last slide. Thank you very much for watching. We were covering the axial skeleton, and I hope it was helpful.